Hi, this is Kathryn Macdonald, and this is the fourth webinar on supporting Indigenous youth using dialectical behavior therapy skills. And this session 4 is on the area of emotional regulation, and we'll be looking at various skills to manage that. This is me. Again, I have no pharmaceutical affiliations or other conflicts of interest. And here again are the goals for the series. So session 1 just gave us the context and the framework and a bit of an introduction to DBT skills and coping skills. And session 2 focused on mindfulness, which is the bedrock of all of these skills, and it keeps coming back around and is an important part of all the strategies. And then in session 3 we did distress tolerance, and I'm going to review some of that today. And then today we are going to focus on new information on emotion regulation. So again, we've been looking at ways that we can maybe adapt for culture, and that's potentially helpful depending on the youth's individual belief system. And these strategies can help youth to not act impulsively based on acute distress, and that's really the goal of these strategies. Actively suicidal children and youth need full assessment in a secure environment, and this is not meant to be a replacement for that. But for many, many people who have chronic suicidal ideation that they control, sometimes with self-harm, these skills can be very helpful. And ideally, we want to build up the skills so that suicidal ideation does not get to the point where people are acting on it. Again, the manual from Jill Rathis and Alec Miller, which is a DBT skills manual, specifically written for adolescents, and all of the examples that I'm giving and all the pages are from this manual. And I would strongly suggest, if you're working with youth where they have frequent problems with emotion regulation, distress tolerance, and suicidal ideation, that this is a very, very useful resource and where I would strongly recommend getting it. All of the handouts that I'm showing you are available with this book. When you get the book, you get a link, and all the handouts are downloadable so that you can actually hand them out. This is sort of my model of DBT skills, and just showing that mindfulness underlies all of it. And then we have the distress tolerance that we talked about last time, which is really managing emotional crises and strategies for managing your distress without using drugs and alcohol and self-harm, and then reviewing, unhealthy coping strategies and teaching new skills like distraction and self-soothing in healthy ways, not negative ones. And today we'll talk about emotion regulation, and next time we'll be talking about interpersonal effectiveness and what Linehan refers to as walking the middle path, which is really, again, about dialectics and behavior change. Underlying all of this as well is the whole idea of promoting wellness, and I use the First Nations wellness continuum as the image on the title page. For very good reason. I think it's very, very important that all our strategies are not just avoiding illness, but promoting wellness, and that we should always have a focus on stability and skills to help people manage distress in all settings. And we want to help to stabilize feelings when people get emotionally overwhelmed and contain their emotional distress so that they have more ability to problem solve around safety, so that they don't get so caught up in the emotional roller coaster and distress that they end up acting impulsively, either harming somebody else, harming themselves, or doing something that has negative emotional consequences or negative consequences in general. So many of the skills, as I've said in the past, have parallels in various cultural practices, and I'm specifically referring to mindfulness strategies, of course, but many of the others, the emotional regulation as well, and distress tolerance. So prayer and contemplation of various types, being in with the natural world, walking, hiking. In some settings, they've used labyrinths, which have been helpful, yoga, drumming, singing, dancing, smudging. All of those are culturally relevant practices from various cultures that can be integrated into day-to-day life and can also be called upon at times of distress to help soothe your emotions. Again, just to clarify, I'm not trying and I'm not able to provide all the possible cultural and spiritual connections, but if you can find people in the community who are willing to go through some of these strategies with you, there may be ways of making those connections specifically in the communities. And I will be working on a manual that is more, has a more Indigenous focus, and that we'll be able to send that out at some point in the fall, I hope. So again, we want to be trying to connect youth to the things that are important to them, and if their culture is one of those things, that is an important part of helping them develop a sense of belonging, and that can go a long way to soothing discomfort and teaching them to use healthy rather than unhealthy strategies. Again, just a caveat, anytime there's a child or a youth who's struggling, you need to have a crisis plan. And so having a crisis plan may involve a list of support people that they can go to or that they can call if they're distressed. That might be a nurse, it might be a doctor, it might be a grandparent, it might be an elder in the community, it might be a crisis line. But having those go-to strategies is really important. And then, as we talked about in the last session, a bag of distractions. So some of those strategies for distress tolerance might be things like coloring or a squeeze ball that they can make themselves out of leather, or that somebody can get for them somewhere. Even just a cloth that they could put in water and use on their face to cool themselves when they're feeling distressed can be part of that bag of distractions. And having a bigger bag and a more portable one can be helpful as well. So I'm just going to review a little bit of session 3. So we talked about distress tolerance, and the goal of the distress tolerance skills is to help people tolerate that discomfort until problems can be addressed and resolved. So there are two types of distress tolerance skills. There's the crisis survival skills for those absolutely immediate managing in the moment needs. And then there's the reality acceptance skills, which really is about being able to look ahead and accept what's happening in the current time, accept the reality of things that you can't change, and then looking at what is going to be the best way for you to manage that. So accept it willingly, accept it with anger, or just be able to accept it and move on. Ideally, the goal is to be able to solve problems. So many youth, as I've said in the past, that will say, what's the point, why should I bother? And the reality is that pain is a part of life, and you can't, if you can't cope with that discomfort, you may do things that get you into more trouble, and then that trouble ends up prolonging the pain rather than reducing it. So you want to be able to really think before you act and know what you can do and work out ways that are going to have the least negative consequences for you. The distress tolerance strategies that we talked about last time were crisis survival skills. So the specific strategies were wise mind accepts, self-soothing, improve the moment, pros and cons, and the tip skills. And then we looked at the accepting reality group of skills, which are looking at the choices you can make, turning the mind, and willingness versus willfulness. And then we looked at the idea of creating a crisis survival kit, and that can be that can look like a variety of things, actual physical things, or just reminders of ideas and strategies, or habits that people can get into, like singing or dancing, that are able to help them get past those crisis points. Wise Mind accepts is a lot of the distraction skills, so activities, contributing, comparisons, emotions, pushing things away, thoughts and sensations. So doing something to keep your mind off the problem, doing something for somebody else, comparing this situation to other times that have been worse that you managed to get through, managing your emotions using artistic endeavors or other things that are soothing for you, finding ways to distract yourself from what's going on, changing your thinking using words or music, and then looking at other sensations, changing, enhancing other sensations so that you're not thinking about the problem. And this is an exercise, so 6 senses is one that uses specifically those 6 senses to self-soothe, so using vision, hearing, smell, taste, touch, and movement, all to help tolerate distress in the moment. Improve the moment involves things like using imaging exercises, mindfulness, looking at finding purpose and meaning. Prayer can be helpful, relaxation exercises, so progressive muscle relaxation, or if you have a friend who's willing to give you a massage, that can be helpful. Practicing focusing on one thing in the moment, so focusing your attention on one particular thing that lets you let go of the problem that's causing you distress. Taking a vacation from your own mind, so going for a walk, doing something that gets you away from the distress, and then learning to tell yourself positive things. The pros and cons exercise really is about looking at the pros and cons of the way you've always done things by acting impulsively versus what would be the benefits and the risks of learning to tolerate your distress. And this can be helpful in convincing kids about why these skills can be useful to them. And then we looked at the tip exercises. So using temperature, intense exercise, paced breathing, and progressive muscle relaxation to change the heightened sensation that sometimes stops people from being able to think and problem solve. So if you're too revved up, you can't think through your strategies. And sometimes using cold water on your face or doing aerobics, so whether that's jumping jacks or running or sit-ups, practicing your paced breathing and then doing some muscle relaxation can help get your brain back to a point that it can actually look at the other strategies. So we looked at the various kinds of things that you can have in a crisis survival kit, including puzzles and coloring sheets and little images that are funny, cartoons, that kind of thing. Strategies that you can list for people that let them use their senses to soothe themselves, and then some of those managing extreme arousal strategies. Then we talked a little bit about the whole idea of accepting reality, and there are 5 alternatives in any situation. You can solve a problem, you can change how you feel about the problem, you can accept it, you can stay miserable, or you can make it worse. And that pretty well every problem-solving situation involves one of those options. And you have a choice of which one of those you use. And so helping youth to see that they have those options and that they can choose to make it worse, but that is also a choice that they're making, is helpful. Willingness versus willfulness, so the idea that willingness is doing exactly what the situation calls for and being effective and making change, whereas willfulness means that, no, I won't talk to the hand kind of not facing reality and not doing what's needed in the situation, but which then ends up perpetuating the problem. And so if you can help them collect examples of each and switch what happens, situations where they have been willful and refuse to face reality and refuse to accept it, and how that might have been different if they had been willing to make the other changes. So building this crisis survival kit is a fundamental part of helping youth to help themselves, because ultimately they're not always going to be able to come to you, and they need something that they can take with them that they can turn to in times of distress. So you want one kit that they can have somewhere where they don't have to carry it around, and one that can be actual small objects or just a card reminding them of ideas that they can carry around with them. So today we're going to focus most of our time on emotion regulation and the skills that go with that aspect of dialectical behavior therapy skills. So one of the things that is important is to understand that many, many, many people struggle with their own emotions, identifying them, seeing the point of them, and accepting them. And this is an important concept because particularly where people have been traumatized, particularly when they've been traumatized when they were young and where they haven't had a lot of supports, emotion is often seen as quite a negative thing and something that is better numbed out than experienced. And so finding the things that are important about emotions is an important aspect of this. So our emotions give us information. They give us information about ourselves and about the situation that we're in, and they give us information about other people. And they're also a huge part of our communication with other people. And they are also a big piece of what motivates us and prepares us for action. So if I often use the example with youth about the idea that stress is not a negative thing in all situations, and that in fact athletes and actors will go to great lengths to increase their stress before they play or run or act, because they're more on their game when they're a little bit stressed. But the problem is that when the stress gets too high, it actually interferes rather than enhances performance. And so it's important to see that emotions are not bad or good, they just are, and there are positive and negative aspects to both of them. But understanding the need for emotion is important, because what happens when emotion is an uncomfortable thing for people is that they tend to try and numb it out. So the goals of the set of skills that we call emotional regulation are to help people to understand and label their own emotions and those of others if possible, and to learn skills to decrease the occurrence of unwanted emotions. It won't necessarily stop them from happening, but it will give them ways to control them so that they don't take over. And then so decrease the frequency where things like anger might come up, and then also to decrease their emotional suffering, because that's often what happens. And as I said earlier, people often struggle, people of all ages struggle with tolerating emotion. And we often don't like to experience what we would consider negative emotions like pain and sorrow or anger. But all of those things have a role in our communication, in our existence. And you can't numb one emotion without numbing all the others as well. So for example, I say to people often, I see a lot of people who are depressed, and they always want to numb out that feeling of depression. But the problem is that you can't really numb one emotion without numbing the others as well. And so when you numb your pain, you often lose your capacity to experience positive emotion to the same degree. So you lose joy, for example. And people, one of the things that we know is that people who have chronic problems with regulating emotion may actually be more sensitive to emotion to begin with. And so those emotions that they feel are more overwhelming for them than they might be for somebody else, and they struggle with that. So helping them to kind of identify the difference, for example, between fear and anxiety or anger can be really important, and tweaking that so that they know what are the situations and the triggers in which those emotions arise, and what can they do to prepare themselves for those emotions. They may not be able to prevent the emotions, but they can prepare themselves so that they can deal better with the emotions. As you probably remember from your own youth experience emotion very intensely, and often they don't have the strategies to manage that intensity. And so if you remember the pain, the euphoria of being in love for the first time, or the pain that the ending of that relationship caused, because you don't have other experiences with those emotions, they are incredibly intense. And so they don't often know what to do with the degree of heightened emotion. So some ways that they tend to deal with things are by venting the energy and the distress triggered by those emotions in various ways, many of which may be unacceptable. So fighting, for example, or punching walls, or breaking things, or throwing things, or hurting the people that they love and spewing negative words at people because they are trying to get rid of that internal distress. And so the consequences of those behaviors where they try and vent those emotions can be really problematic for people, because then, in fact, other people are angry with them, and then that just tends to perpetuate the discomfort. And so helping them to make better choices for what to do with that emotional intensity can be very, very important for their well-being. So people often will struggle with, I think in the very first session I showed you the cognitive triangle, which is that those connections between thoughts and feelings and actions. And people often struggle with those cognitive behavioral concepts because they're not very good at identifying the emotions. So one of the exercises that you can do with people is just to talk about situations where they experience different emotions, and just to help them tweak their understanding of, you know, what are the things that trigger feelings, and this is this feeling, this is anxiety, this is anger, this is disappointment, for example. I often use the example of seeing something happen to somebody that you care about, so an accident or something like that, where fear gets expressed as anger. We see this often in parents of young children, where a child will go to touch something hot and the parent will seem angry and hit their hand, but it's not really the parent's anger that they're feeling, it's fear of what will happen to the child if they touch the hot object. So sometimes there's a fine line between our emotions, and they're not always easy to separate. So practice in identifying emotions and linking them to situations and triggers can be a very helpful exercise for a lot of youth. So in the Raffis and Miller book, they use a model of emotions, which is quite a complicated chart that you can pick or choose whether you're going to use it to help youth. But I think that sometimes it's just helps to have some kind of model for showing them where the triggers are, or what the triggers are and what might make them vulnerable, and then what are the emotional reactions, and how do those play out in behaviors, and then what are the consequences to those behaviors. It's also helpful to really talk to them about the fact that there's a very big difference between the urge or the desire to do something and actually doing it. So you might have an urge to hit someone, but you can choose not to hit them. And having that urge to do it is not the same thing as acting on it. And so learning where and how those things get triggered and how to help yourself manage your urges can be a very important part of managing behavior and emotion. So this is the model of emotions that they use in the book, and they talk about the vulnerability factors. They talk about what are some of what might be a trigger, so the prompting event, and very importantly, what are the things that you feel in your body, and what are some of the urges and actions that you feel that you want to engage in as a result of that feeling. And then what is the emotion that you're experiencing? So what's happening internally, and then what's happening externally? What are other people seeing, and what are you doing? So what are the actions, not just the urges, but the actions? And then if you do act on that, what are the after effects of that? And then what other events are prompted by that? And then again, where does the thinking come in? So again, it's just about finding the connections between vulnerability, triggers, what's happening, so your emotions and your thoughts inside, what's happening outside in your body language and your behavior, and what are the consequences for those events. And in the next handout, they actually put in the various skills that some of which we've talked about, most of which we've talked about at this point, that will help you to manage those different changes. So in the things that make you vulnerable, we haven't talked about this part yet because it's later in this session, but the accumulating positive emotions and building mastery. What can you do? The coping ahead ideas. And what can you do that will help make you less vulnerable to those emotionally triggering situations? And some of those are just life skills, and they're helpful for all of us. How can we be more aware of our thoughts? How can we be aware of how our emotions affect our thoughts, and how we interpret situations that might be having a negative impact on our experience of situations? In the body changes, that's where a lot of the mindfulness and crisis survival skills from the distress tolerance come in. So how can we manage those body changes so that we don't necessarily act on the urges that might cause us problems later on? And then what can we do to change our emotional reactions? So in the external world, how can we look at different ways of managing our distress and our emotion so that it doesn't have the same, have a negative impact? And then there's an exercise that you can do working through an event with youth. So something recent that's happened to them, so that you can actually work through one of these exercises and help them find the ways that they can change their behavior and change their responses to things that will perhaps lead to fewer negative consequences later on. This is a good way of using, so as I've said in the past, you can use the exercise sheets as a way of keeping track for yourself of things that have worked for the youth. And you can help them, you can use those sheets to help them work out in a situation like this or a practice exercise like this, what's worked for them in the past and what could they try in various situations. So the ABC Please overview is an idea, it's a plan for, or a goal for increasing positive emotions and reducing the vulnerability of the emotional mind. So again, if we go back to the concept of emotion mind versus reason mind, and then wise mind. We're always looking for the ways to pull emotion and reason mind into position so that wise mind really has control over what happens. And so some of the things that we can start to help youth to focus on is accumulating positive experiences. One of the things that really happens when youth have struggled for a long time is that they have not, they don't focus really on positive things. They collect all the negative experiences and they dwell on those negative experiences, but they don't look for and seek out positive experiences that might balance that. And then helping them build mastery. A sense of competence and independence is very, very important for emotional well-being. And again, this is something that often isn't done on a regular basis, and youth don't necessarily know how to put themselves into a position where they are developing those mastery skills. Learning to identify the situations where you are more vulnerable is important. So this idea of coping ahead means that you can take yourself out of situations where there's a high risk, or you can prepare yourself ahead of time going into situations where you know there's a high risk, so that you have a plan for either leaving if things are getting out of control, or using your skills to keep yourself under control so that you don't lose it in a situation where there's stress. And then there's basic, just again back to wellness and a focus on wellness. Basic things like making sure that you're physically well. If there's a physical illness, if you have asthma, if you have diabetes, if you have any chronic disorders, that those are under control, and that if you do get an infection or some other acute illness, that those are treated quickly. Eating is a really important part of wellness, and I know that where there's a lot of poverty, that can be a real struggle. But a lot of youth turn to really junky foods, and that really can have a negative impact. And I'll show you a list of some of the things that you know, bad eating habits can contribute to. One of the things at Six Nations that has been a real focus over the past year has been a return to traditional foods. And there is a Facebook page called Healthy Roots, where people have shared recipes with traditional foods and really gone back to trying to stay away from the junky foods that have created so many health problems and get back into a healthier way of living. And this is certainly something that can be done in all communities, but there's a model certainly in the Haudenosaunee community of Six Nations. Avoiding, so the A is so ABC, please, the L is the end of the physical just to make it easier, but so treating physical illness, balanced eating, avoiding mood-altering drugs, so any kind of opioids, alcohol, cigarettes, anything that has a negative impact on the brain and the body is something that ideally you want to avoid. Sleep is a tremendously important part of well-being, and a lot of people struggle with this. And there are many, many things written on sleep hygiene, but there is a handout that I can send. I think I actually took it out of this presentation, but that is something that we can provide for all of you, but I'm sure that that's something that you do on a regular basis anyway. And then the E in the ABC, please, is exercise. And exercise, we know regular exercise is almost as effective for mild to moderate low mood as an antidepressant is. But more than that, it's just plain good for your body and your brain. So accumulating positive experiences, you want to find there's a mixture of things. So positive experiences that you can do immediately, and then positive things that will be lasting and build a basis for a healthy and productive life. So you want to collect pleasant things that you can do immediately. So pleasant activities tend to lead to pleasant emotions. So walking in the woods or being with friends or singing or dancing, those are all things that can be done immediately and in the moment to shift the emotion into something more positive. And so what we want to try and do is work with youth individually to make a list of activities that they find pleasant, that they can do alone or with other people, that can, I call it filling up that glass. That sometimes, you know, we've got a tank in us of positive energy, and that gets depleted over time if we don't refill it. So we use it up when things are difficult, but if we don't engage in pleasant activities and positive activities and refill that tank, we run low, and that's when things feel really awful because we don't have any of that positive energy to work with. So trying to actually get people to engage in those pleasant activities and refill that tank is really important. Mindfulness practice can be really helpful in general, but it's particularly important that people engage in mindfulness practice when they're doing the pleasant activities so that they maintain that awareness of the positivity of those exercises and those activities. So what do I enjoy about this? I feel good. This is what it feels like to feel good. This is what it feels like to feel happy, so that you have something to attach to the abstract concept of happiness or feeling good. And that can be really, really important at times when people are feeling down, because you can use it as a bit of a touchstone. Remember that time you were walking in the woods with Joe and you felt really good, you felt really happy. Remember that time you were fishing with your sister and you felt really happy. So being able to remind people of times in the past that they felt good is really important. And then being able to be mindful in those activities means being able to pull the mind back to that positive experience while you're in it and away from the worries and negative thoughts. And I come back to the very first session. I think I showed you this, the circle of courage, which comes from work that Martin Brokenleg, who was looking at the impact of the residential schools on Lakota culture and how where the strength of Lakota culture came from before all of that trauma. And he found that fundamentally the sense of a need, everybody has a need for belonging and for mastery and independence and generosity. So those are fundamental parts of a healthy life and a healthy community. And these are things that you can draw upon. So doing pleasant activities with somebody else, doing something that makes you feel good. So pleasant activities that aren't always fun. The pleasant part can come from feeling that you've accomplished something or feeling that it's giving you a skill that makes you more independent. And sometimes, very, very frequently, and this is part of the long-term planning for filling up that tank, is giving back to the people you care about. So whether that's your family, your friends, your community, but giving something back, it might be to nature, but giving something back is an important part of feeling good in the long term. So developing a long-term plan means shifting values to a more meaningful approach to living. So, as I said, contributing to the lives of others, taking care of relationship with friends and families, and the people who are important to you, engaging with others, having fun, but being part of something, building character. And character is somewhere where the seven grandfather teachings, that's a fundamental part of character. Responsibility and leadership, so being a leader in the community, being a youth leader perhaps, and then achievements. Achievements, that might be in learning, that might be achievements in your own health, but things that are just things that you can feel good about and feel that you've accomplished something. So you can make a list. If you want to use sheets like this, you can certainly, this might be a good exercise to go through with a youth who struggles with how to build a life that's worth living. And again, a lot of this is the goal of helping people to look forward to a healthier future. So these are the handouts that go with that, the concepts that I talked about earlier. So B, for building mastery. What can you do that would be something that would make you feel that you were building something for yourself, that you had learned something, and make you feel more competent and in control of your life. So the idea is to plan for success, but you also have to be able to accept that things can be a struggle, and that's where some of the distress tolerance may come in. So gradually, so starting low and building things up so that you're not getting overwhelmed and quitting, but so that you have something that you can build over time is important. If the task is too difficult at first, then breaking it down into smaller components. And this is where, as a professional, that your role might be to help the youth to break those things down into smaller tasks so that they can find something where they can feel a sense of accomplishment and then do the next piece. And when you put all of those small accomplishments together, they have built something stronger. The cope ahead idea, so being aware of situations that are going to be emotionally intense and planning ahead of time so you know what to do, you're prepared for if there's going to be a problem, knowing your triggers, deciding ahead what you're going to do and what strategies might be helpful for you from the DBT skills that have been learned, then actually playing through the mind. So if you know that, if you know or the youth knows that you have to go and meet with someone who you've had a problem with in the past, actually imagining your way through that encounter in your mind before you go can be a really helpful strategy. So we call that coping ahead. And then the rest of the please skills. So as I said before, treating physical illnesses, looking after your body, balanced eating, avoiding substances, sleeping well, and exercise. So this is just a handout that you could give to someone. So this is someone to me that there's something that might be useful on a card or even on a sheet on the wall of the office. And again here, these are just exercises that allow youth to have their own record of what works for them and what they can try. And for youth who don't really want to do the reading and writing, this is something that you could keep track of, and next time they come in, you can review again. The acronyms, I think, are really helpful because if you go over and over those acronyms and what they stand for, ideally, then even the youth who don't want to do the written work may be able to develop a memory for what those acronyms stand for. So I think, you know, the basic self-care is part of that wellness model, and I think is really important. So some of the ideas are basically things like just basic sleep hygiene, consider a traditional diet, getting away from junk food, regular exercise, so running, dancing, paddling, sports and games. Those are also things that can make you part of something, and so that sense of belonging is really important in terms of emotional connectivity and also regulation. Wave skills, so this is a way of helping people to develop an awareness of their current emotions and just being able to last through it. So keeping that awareness and using the strategies so that, okay, I'm angry, I know that I'm angry, I don't have to act on this, but I am feeling angry and it's a wave and I know that it is going to go away eventually. I'm not going to try and push it away, I'm not going to try and get rid of it, but I'm not going to hang on to it either. I'm just going to observe that it's there. And If it's anger, often I would be feeling it in my chest or in my shoulders. So being aware of those sensations, but again, not acting on it, and just being aware that this is a wave that's rushing over me that will also dissipate in the long run. Keeping in mind that I don't have to act on the feeling and that I'm not the emotion, it's just there. It's not good, it's bad, it's just there. And trying then to remember times that you felt differently. So helping the youth, if they're really angry and they're caught up in that anger, getting them to remember that there are times like when they were walking in the woods with Joe when they did feel happy, and that those times will be there again, but that right now they just have to ride this wave and let it go. And accepting that anger is part of being human, as is fear, as is sadness, as is pain, as is joy and happiness, although some of those you might have felt less than others. And so just being able to accept that it's there and part of you, and learning to just let it pass can be a very important skill. Check the facts and problem solving. I'm not going to go into detail, but it's again it's a more detailed problem solving approach. But just getting people to look through the problem and make sure they're using wise mind and not emotion mind to respond to a problem. So is there another interpretation of the situation? Are they thinking in black and white ways? What's the worst thing that can happen? What's the goal of solving the problem? Let's look at all the different solutions. And I think this is, again, one of these things where if you can go through it with the youth a few times, it will build a skill that they'll then be able to use more on their own. How you put, once you've looked at the solutions that are possible, how do you choose one? And once you choose them, how do I put that into action? And then what happens once it's done? I call this is a variation on the PACE technique, which is in the CBT manual that is on the website. So you can certainly look at that for a simplified version of this. One of the other options is to look at the urges associated with, or I guess one of the other skills is to look at the urges associated with different emotions and try and push yourself to do the opposite of what the urge is. Because the urge is usually trying to get you to act immediately. So if you're frightened, your urge is to fear or run or escape. If the emotion is anger, the tendency is to want to attack. If it's sadness, it's to withdraw. If it's shame, you tend to want to hide or avoid, again, withdraw. Guilt will be to, say over and over, you're not going to do it again, and maybe avoid responsibility. So in all of these situations, you can do what the urge says, or you can try and do the opposite, which often has a much better outcome. So if you're anxious, obviously, not in a situation where, if there's a bear and you're anxious, you probably don't want to be overly friendly, but certainly running is often not a healthy response, because from any creature you're going to get more of a chasing response, whereas standing up and looking big or being calm rather than running can be a much safer approach. In anger, being able to avoid the person that you're angry with rather than attacking them can give you time to take stock of what the goal is and better ways that you might be able to manage that situation. Sadness, when you're sad, you tend to want to withdraw and hide away and isolate, but in fact that tends to perpetuate the sadness. So encouraging people to get active and go out and seek people out, do something pleasant, and actually do something that makes them feel competent is a much more helpful approach to sadness. If someone is feeling guilty about something, taking responsibility tends to get a much more positive response from other people, as well as from your internal sense of self. So those are ways that you can use opposite actions to help change emotions and to often get a much better response from the world around you than you would if you went with the urge. So this is a way, just a sheet where you can keep track of some of those things, and that can be helpful. This is just the wave emotion again, so I'm not going to go through that in detail, but you can look at, again, what's the experience of the emotion and just talking yourself through it so that you don't act immediately and you can let it dissipate. So that's the emotion regulation exercises. And again, I would suggest that you try and go through those. Ideally, if you can get the Miller and Rafa's book, that would be helpful. But there are also numerous apps on for iPads and phones that go through a lot of these exercises. And I can certainly have those put up on the website for you because I think that they're really helpful and would help you probably talk the kids through them. So that was session 4. We've now done mindfulness, distress tolerance, and emotion regulation. In sessions 5 and 6, we're going to go through interpersonal effectiveness and walking the middle path, which is using those dialectic skills. And then session 6 will do a review and summary and more of the integration with cultural aspects. Thank you very much.